Hello everyone, it's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipofoams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. Guys, Ashley with Amare. So today we're going to talk about the surprise things after surgery. The 2 main surprise things, and I have a before and after coming out next week that shows this. So surprise bruising and surprise swelling. So it's no secret that after surgery you look great, and then after like day 2 you start to swell, and then after like day 3 and 4 you're like swollen, and it's like not bad, it's like whatever, but then you like the swelling stays. And then maybe by like week 2, if you're not getting true hands-on manual lymphatic drainage, if you're in the wrong kind of garment, if your garment doesn't fit properly or is like cutting into you weird, you swell even more. You get like this surprise swelling out of nowhere, and you're like, holy shit, I'm blowing up and I need to find someone immediately. And that's usually when you guys find us. It's usually when you come in and you're like, I looked great. Like right after surgery, I looked amazing. I can show you what I looked like. And I'm like, I don't really need to see, because like we're gonna work on this now. But you're like, I could show you what I looked like. I looked amazing. I was so snatched. My BBL looked great. And then like even a week after it was fine. And then all of a sudden I started to blow up. Or like I had bruising and then it started getting better and then it started getting worse. And like now I have these like my bruising is moving into places where I didn't even have surgery. Like bruising on the lower abdomen, moving into like the thighs, the top of your thighs, where you didn't even have surgery. So like, what is this? Why does this happen? So it's super common. Let's start with the bruising. So if you're in a garment, a compression garment or a faja that is squeezing you in the wrong places, that garment is pushing fluid into other areas of your body. So let's say you just had lipo, right? It's just lipo of like right here, right? And you're in a garment that's not cut properly and the seams aren't right and it's either too tight or too loose. And I say this all the time. It's kind of like wearing a pair of shoes. If you're a size 8 and you get a size 7.5 or you get a size 8.5, it's going to fit, but it's going to leave sores on your feet, or it's going to rub in the wrong way and it's not going to be comfortable. And over time, it's going to leave like some issues. So it's the same thing with a garment. If that garment is squeezing you here so super tight, you have no circulation of your lymph fluid at all. Now keep in mind, lymph vessels are only a hair thick, you can't even see it, a hair thick. And it's a very fragile thing. So if you squeeze too tight, or if you don't have enough compression, gentle compression, it's not going to do anything for your swelling, for your lymph system. So that garment is way too tight and squeezing. So it's going to put pressure on all of this, and all of that fluid is going to go above and below the garment. So if your garment, and this is why our garments have long legs, our garments come like mid-thigh. Sometimes a little bit lower depending on how tall or short you are. But if all of that isn't covered, that fluid is going to leak out of the place that's being squished up and down or all around to where it's not. So the best example of that is a binder, right? Let's say you had lipo, not a tummy tuck. Binders are used for tummy tucks. But I've seen doctors who don't know what they're doing or just don't really care post-op put you in a binder, all like that little like wrap thing, right? Or like a waist trainer, whatever you want to call it. They'll put you in that and you'll get massive swelling on your pubic region and into your thighs, and you'll get massive bruising in your pubic region and in your thighs. And your thighs weren't even touched. Maybe they did your pubic region, but nobody really lipoed your thighs, so why do you have swelling there? Also, you'll get swelling all up here, sometimes even right under here, and all up in your back, and you'll get bruising there too. That like comes out of nowhere and you're like, oh, I don't know if my doctor did that area. Why is it bruised? They told me they didn't do that area. Why is it bruised? Because you're squishing yourself. And so bruising is blood and broken tissue that you can see under the surface of the skin. So think about it. It's so like right there, right on the surface of the skin that you can even see it, which means that it's not in the tissue anymore. Your body's trying to process it out. How does it do that? Your lymph vessels, where your swelling is right beneath a hair, right beneath your skin. So much so that you can see it. So when you have something like bruising, you can see it. So when you're talking about squishing the fluid, you're squishing that blood and all that stuff that's on the surface of your skin all around your body. Instead of it going back into your tissue and your body absorbing it and processing it and transferring it out into your urine so that you pee it out, it's just being squished around in your body up and down. So that's where you get the surprise swelling from, because that swelling and that bruising is initially in your tissue. And it's our job with true hands-on manual lymphatic drainage, the gentle pumping motion. That's it, super, super light. It's our job to dilate your lymph vessels when we're doing that kind of, massage, to get your body to open up, your tissues to open up and suck that fluid and that bruising and all those little pieces out from back under your skin, back into your tissue so your body can absorb it. The job of your garment is to hold your body so that you don't swell anymore. It doesn't get rid of swelling. Garments don't get rid of swelling. True lymphatic hands-on manual lymphatic drainage gets rid of swelling. The garment is just to hold you where you're at so you don't swell more, which is why when you shrink and you shrink and you shrink and you shrink and you come down sizes in your garment, after, you're at your baseline, you don't need a garment anymore because there's no more swelling in there, so the garment's not doing anything. So why do we get this surprise swelling and bruising? It's because all of that swelling and all of that bruising, that blood, those little, dead cells and things were in your tissue, and you just put on something that squeezed your tissue so hard that it pushed all that fluid around everywhere, and now you're seeing it on all these weird places. Whereas usually that bruising and swelling would stay in that area held by the garment until a professional, an actual manual lymphatic drainage therapist, dilates your vessels for your body to suck it back and pee it out. Now, without lymphatic drainage, when you're wearing that garment, if it is the correct size and you're not getting lymphatic drainage treatments and you're not doing actual post-op care, like true real post-op care, that stuff will just stay there until your body processes it out. Now, how does your body normally process it out? Well, your lymph system only moves through full body movement, through musculoskeletal movement, meaning you have to actually do lots of crazy actual movement to get those vessels to pump. They don't have their own central pump. It's not like the heart where it just circulates stuff. So you have to actually move to cause that circulation to get that blood to go back into your tissue for your body to then process it out. Except post-surgery, you're exhausted. You're not getting up and going to the gym for a while. You're not getting up and moving around like that. You're not doing full body movements because you're sore and your tissue's broken and you have incisions, and you can't do that, which is why hands-on manual lymphatic drainage creates and mimics that pumping motion to your vessels to dilate them and get them to function, to suck that fluid back, to suck that blood back, get it back into your body so you can process it out without having to do, aerobics or swimming or yoga or things that you definitely should not be doing for at least 6 weeks, if not 3 months, depending on the surgery you had. So again, garments just hold it and we get it to come out. So if you're doing that squeeze massage thing, or if you're having somebody do wood therapy or rollers or machines or any of that stuff, it's not actually pumping your lymph system. That stuff is just moving the fluid around in your body and squishing it. If you've ever seen those little toys where it's a tube and it's got that fluid in it, and you squish one side and it all goes up, and then you squish one side and it all goes down, and you just squish, squish, squish. That's basically what those people are doing to your lymph system, versus dilating your body so that that fluid stops being in that little, bag right beneath the skin and sucks it out and gets rid of it. They're just squishing it around in there all over the place, and it's still trapped underneath your skin. So again, same thing in a garment. If you are squeezing the crap out of yourself, you're just squishing and all that fluid's going elsewhere and still trapped under your skin. So when you're looking for a garment, you want to make sure that you're not squishing, number one. Number two, if it feels too loose, if it's this loose, it's too loose. But if it's really tight, where you're all the time and it's not comfortable, it's definitely too tight, and you're definitely gonna cause that internal swelling to come out under the skin and cause problems elsewhere. Now, part two to this, that swelling that is elsewhere, it gets stuck in that area. If you're not getting lymphatic drainage, if you're not using a proper garment, if you're not doing your post-op care, that's gonna become fibrosis, because now it's trapped between the skin and just above the tissue, instead of being in the tissue where it belongs to get processed out. So it's stuck in there, and then it gets no movement, and then let's say you have salt or not enough water, or you do something else that causes fibrosis, which is scar tissue. That fluid gets stuck in there, gets dehydrated and compressed, and becomes really thick and hard, like hard Play-Doh. And that's fibrosis, and that's how that happens. So back to my original point, this surprise swelling and bruising, this concept of like, oh, I looked great, and then 2 weeks after, my body just swole up like crazy. Well, it's not that your body swole up like crazy, it's that your body wasn't processing that fluid out to begin with. You did something and it squished all the fluid out of your tissue and got it stuck just beneath the skin. Same thing with the swelling. Rather than that bruising being in the tissue, it started coming out up to the skin to try and get processed out by the lymph system, because that's how it works. The blood, the broken tissue is in your tissue, and then it comes out to the surface so your lymph vessels can catch it and take it out of the body and push it out through your urine. So sometimes with our clients, if you come in like super fresh after surgery, I mean like 2 days after surgery, your bruising is going to get worse because we're expediting that process. We're getting your body to filter out that bruising a lot quicker. So that means it comes to the surface quicker and your lymph system skims it away quicker. So your bruising looks really bad for like 2 days and then it's gone like that. And then it just disappears. But again, if you're not doing any treatment, that bruising will get squished to the surface somewhere else, like I said, in your thighs or like up into your armpit area or even like under here. And it'll stay there and look weird and take forever to heal and take forever to go away, and you'll get swelling in that area too because you're unnaturally forcing that stuff out of your tissue, whereas normally it would travel to the surface of that area and the lymph system would take it away and discard of it. So that's why that happens. That's the same thing with swelling. That's why you swell up and look crazy after like that 2-week mark or even like a 1-month mark. You get all this random swelling out of nowhere and you're like, oh my God, what happened? It's because your body wasn't processing it out. And then you were in a garment or you weren't taking care of yourself or you weren't doing actual massages and it came to the surface and now it's like stuck there and squished in areas that it wasn't meant to be in the first place. If you had lipo over your stomach, this is what's going to be swollen. When you're in a garment, it holds the swelling there, and your body's meant to naturally process it and make it go down, or with your lymph massages, they naturally go down. But if that's not happening, it's going to squish it into an area that didn't have surgery, that's not being held by the garment on top of that, and trap it there and make it worse. So that's where that surprise swelling comes from. We can absolutely get rid of it. We do it all the time. It's super quick and super easy once you have a professional that knows what they're doing, somebody who's doing your lymphatic massages that knows what they're doing. But yeah, that surprise swelling, it's the swelling that was meant to be somewhere else because you had lipo here. The swelling and bruising was meant to be here, but it got squished into an area that it wasn't supposed to be in, and now it's looking all kinds of crazy. So that's where that comes from. Again, there are other reasons you get surprise swelling, like having too much salt, like not drinking enough water, like doing things you're not supposed to that causes more internal damage and causes more swelling. A lot of the things that I see are from those $60, $80 drainage massages where they're rubbing over you with oil, hooking you up to some sort of vibrating machine, using wood therapy and all kinds of stuff, because again, that internal tissue is like a sponge and it's full of fluid and it's full of bruising and dead cells that needs to be cleaned. If you're taking a wood roller and going over that and squishing that sponge, it's going to push all that fluid out to other areas of your body. Now, where is it pushing it out to? If this massage person, let's say you had lipo here, is squishing like this down towards your incision and cutting your incision open and blood is coming out, first of all, you need that blood to heal. Second of all of your swelling, again, think about that squishy toy that I was talking about, is now squished into that area, and you're going to have a giant patch of swelling and possibly even fibrosis over that drain area or pubic area where they said they were draining the fluid out of. You're going to have a really, really big, thick patch of fluid because now they've dehydrated it by taking out the blood and taking out all of the hydrated parts of it. And they pushed it into one centralized area and compacted it. So now you have fibrosis and swelling in that one big patch area. The rest of you may look fine, but all that swelling was meant to be evenly distributed to help you heal and protect that area. So now this area up here is going to be super sore and hurt a lot and not feel pretty great. It may look great, but it's going to feel like you got beat up because you kind of did. And then the area down here is going to be super swollen and really either full of fluid or full of fibrosis because they squished all of that swelling that was evenly distributed into one compacted area. So that's another reason that happens. So this is just a quick video on why that happens because I get asked that a lot, like where did this come from? And like I said, we have a before and after coming up next week of exactly what I just said, a bad garment and going to one of those places that push it all, into one area. And you can see visibly in the 1 through 8 pictures where her bruising starts to appear on her body. And it's in those areas that I talked about. It's even in her BBL area because they were squishing the fluid down into like her lower back. And that caused all the bruising to travel down into her BBL. So you can visibly see in that before and after where the bruising starts to appear. And this is why that happened. So again, it's common, but it's not natural and it's not necessary. And a lot of questions that you guys have for me in the room and a lot of these complications that happen post-op, it's common, but it's not healthy and it's not natural. And it's completely avoidable. It's just that you guys don't know any better or the research that you do gives you the wrong information. So guys, please be informed. Thank you for watching my video. This will go up on my IGTV.